Hi everyone, I'm Niloo. I am a certified Glut Pilates instructor and also an internationally trained physiotherapist. Internationally trained means that I'm not registered yet, so be mindful of that one. Today I'm going to teach you a couple of exercises for one of my favorite target muscles, Glut Medius. I was actually recording this video for two of my clients, but then I thought, why not share it with others? So that's why we are here to learn those exercises. Hope you'd enjoy it as well. Before we start any of the exercises, I want you to consider that these exercises are not replacement for your therapeutic exercises, and that you are not supposed to feel any pain except for the muscle work pain during any of your exercises. So be very mindful of this. Now, the target muscle, as I mentioned, is going to be your glut medius. However, I want us to warm up the muscles around the hip joint area first, get in touch with the core next, and then go for the real original exercise. We are going to, for this purpose of warm-up, we're going to lay down flat. We are going to start by a couple of imprinting and releasing. As you imprint, you connect your chest to your pelvis. You're going to reduce the distance between your pelvis and your rib cage, and you slow release. You want to do this on exhale, so utilize the strength of your abs, get more in touch with your transverse abdominis, and then you just hold your imprinted spine. And you're going to simply slide your right foot away from your bum. You keep the connection with the floor, you dorsiflex at the bottom, and then you pull your foot back in. Why are we doing this? To challenge the core. Why are we doing this? To stretch your hip flexor muscle here. It's a gentle stretch, and you want to do only a few of this. Going to do only 3. So on exhale, you reach, you flex, you point, and you return. And then you want to switch sides. Go exhale, reach. You're still keeping your imprinted spine, so your abs are tight. Flex at the bottom. I keep forgetting myself. And then pull it back in. Exhale, reach. Don't forget the dorsiflexion, and pull it back. You're sliding your foot. If you want to go for a hover above the mat, go for it. It would make the exercise a little bit more challenging for your core. After this 3 on each side, I'm going to stretch my iliopsoas, the hip flexor muscle, a little bit more as I'm challenging my core and warming it up. So what I'm doing is that I'm dropping the knee down to the side, keeping my foot center straight and my foot right in line with my hip joint. Rotate the kneecap in and slide my foot back in. Throughout this exercise, I'm going to keep this ribcage connection to my pelvis. See, I just lost it myself. So don't worry if you keep losing it. Just keep adjusting yourself to the exercise as you do it. 3 on this side. And then I'm going to switch to the left, dropping the knee to the side. I avoid a wobbly pelvis. I keep everything stable. Pull it in. It is exhale, lower the knee down, slide the foot away, kneecap points in, and you pull it in. Lower down to the side, slide away slowly, and pull it in on inhale. Beautiful job. Now you have softness. Now you have warmed up your iliopsoas muscle. I want us to get connected to our hamstrings as well. So we're going to be seated. Your pelvis wants to be as vertical to the ground as possible, like this. Hands on top of each other. Nod your chin. You keep the length in your spine. As you roll forward, and you're not hinging over your legs, you're rounding. You breathe in. Hold, and breathe out. You flex your ankles as you reach further forward. Gentle stretch all the way out here. And we're going to tail to head. Stack the spine back up as we plug the shoulders. And exhale, round. Forward, use your abs. You never want to just slump down into an exercise. You always want to keep everything active whenever it comes to Pilates. And then on inhale, back up. Remember that this is 4 breaths, so it's going to be slow. On exhale, you round. Inhale, hold. Exhale, flex your ankles and reach further forward. Tail to head build. Let's do 2 more of this, just because it feels good. Go round. Inhale, hold. Feel the stretch in between your shoulder blades as you breathe into the back of your rib cage. And exhale, stretch further. Tail, low back, thoracic spine, head and neck straight and shoulders pulled away from your ears. Round. 1 more time. This is the last one. Inhale, hold. Exhale, flex your ankles more as you stretch further forward, using your abs tight. Keeping your abs tight. Tail to head, build, and shoulder blades away from your ears. Beautiful. Now we are going to get into the exercise. Okay, for the exercise, we're going to be seated in a mermaid position. It's going to be a wide-based mermaid, so you don't want to have your feet touching your thigh. Your feet can be detached from the thigh. You want to push your right knee away so that your knee joint is positioned to the back of your hip joint. You don't want your knee joint to be front of your hip joint, otherwise it's going to be your TFL dominating the exercise. You don't want that muscle to dominate, or you would have back pain. You want to have your glute medius enjoy some attention as you place your hand on the mat. You start with warming up, seeing whether you're actually targeting your glute medius by trying to hover your knee and ankle up and slowly lowering. It's going to be exhale, lift, inhale, lower. And you want to make sure that you are not crunching your side as you do it, although your side abs are working. So it is only lifting your knee up and lowering. If you're doing it correctly, you're gonna feel it here. Then on the 5th one, you're going to hold your knee to hover and only bend your elbow to tilt the shape to one side and lower. The thing that happens is that as soon as you start doing this and your glute medius gets exhausted from the amount of attention we are giving it, your leg starts to shift forward. You don't want it. You don't want your TFL to start dominating the exercise. So push and keep pulling your knee back and keep tilting for 10 counts. You tilt. Again, you do it correctly, you're gonna feel it in your side abs. Sometimes we have weakness in our side abs. Our body tends to tilt and our chest tends to shift towards the ground. You don't want that. Chest shining forward as you keep doing this on exhales and inhales. Let's do 2 more. It is exhale, bending your elbow, inhale up. My glute medius is already getting fatigued from the attention. This time we hold the tilted position, elbow is bent. You just extend your knee and bend. Extend your knee and bend. It's only 5. Remember that you can rest if your body is like, no way, I'm gonna do this further. Bend, keep adjusting your knee. Extend. 1 more on exhale, bend and lower. Whew. Stretch it in a nice mermaid. Enjoy the stretch. And let's switch sides. For switching sides, you can just shift your sitting position. Wide mermaid base, knee to back of your hip joint. You're pushing your pelvis already a little bit forward using your glute max. Glute max is the big bum muscle. We're going to start by just hovering and lowering. Hover and lower. Remember that the hover is supposed to be small Remember that it's okay to get a little bit of cramps in your glute medius. If the cramps makes you anxious, try to rest. Try to press a little bit on your muscle and then lift and up. Otherwise, the cramps are going to go away after 3 reps, usually. If they last longer than 3 reps, then maybe you want to stop the exercise because your body is protesting. And then tilting 10 times. I've already done 3. It is exhale to tilt the shape, inhale up. Exhale to tilt, inhale up. Remember not to allow your head to lower to one side. You want to keep this nice side C curve as you do this. Exhale, inhale. I lost count, but I'm imagining we only have 3, 2, and 1. Hold and extend and bend. One side is usually stronger. Seems like for me this side is the stronger side, as I'm able to keep my knee to back up my hip joint pretty consistently. Keep extending, and only 1 more. And bend and lower. And side went to a nice mermaid. Beautiful job. We did it. We targeted the glute medius. We strengthened it. Now you want to remember, glute medius is a very important muscle. Why glute medius muscle is this important? This muscle is a key link in stability of your lower extremity. Lower extremity is your leg. So you strengthen this muscle, you're going to have strong knee joint, stable knee joint. You're going to have strong ankle joint, stable ankle joint. Less chance of actually spraining your ankle, less chance of injuring your knee joint, and also it's going to contribute to stability and support your low back and core muscles. So you want it strong. This is a very good series to do it whenever you want to only target your glute medius. Remember, we try not to only do one exercise for a single muscle. We always try to work around and address everything around a joint and then make one muscle to stand out. Now, I hope you have enjoyed this video. Thank you so much for following me this long, and thank you so much for giving me a like or a subscription if you like this content and you would like to have more of it. Hope to see you soon again. Bye.